Welcome to a recent interview that I shared with a local alternative care practitioner, Todd LeCesne, who I really think of as an absolute futurist. That is someone that's taking full advantage of the synergistic potential of conventional healthcare and cannabis therapy. I hope you enjoy.
I would expand one step further on cannabis. As a clinician for all of these years, working with all these patients, I think of myself as somebody who's an agent of the patient, and you're sitting in front of a person and you're trying to present options. What can we do to help you with whatever that complaint is? And sometimes you feel like, an archer. I don't want to think about a Robin Hood, but somebody that's reaching up into their quiver and continuing to pull out little arrows and continuing to offer suggestions to help to improve on whatever condition the patient might be presenting with. I have enough experience to not make promises, to not say, hey, we're going to treat that, we're going to solve this, we're going to fix that. I did those things early on in my career. 24 years in, I realized that some things you kind of can't fix. Some things you run out of options. And when I came to cannabis, to me it represented a whole brand new toolbox of options to present to the patient. And that was really exciting to me. The lack of science, the lack of research studies, the lack of patients' experience with, their immaturity in their knowledge about what cannabis can and cannot do, my colleagues' lack of knowledge with regards to what cannabis can and cannot do. All of those things to me represent opportunity for growth individually as a clinician, something exciting to bite your teeth into and to go learn new things, stuff that wasn't discussed at all in any of my medical school education or any of the 12 years that I spent over at the university. And to me, it's just a whole brand new toolbox again of options to present to the patient. So as I'm reaching up there, early on, we used to run out of options. We used to run out of things to suggest. Sure. Patients had already done surgery. They've already done joint injections. They've used all the medications that we can think of. We've sent them to the Mayo Clinic. They still have the it. The problem still exists or so. And the patients invariably still come back looking for help, looking for some sort of relief from whatever it is, And there's even a term in medicine that we use to describe that you've gotten as far as we think that you can go. We call that maximum medical improvement. Gee whiz, it's not like we don't love you. We want to do as best as we can. We've tried everything. I don't really know what else to recommend. And so it dawned on me that maybe what I try to do is to create a clinic that could bring together some of the therapies that are not commonly found in regular primary care practices, urgent care, which I've worked with over all these years, and emergency medicine. In urgent care and emergency medicine, we don't do chronic disease over there. We refer those patients back to their primaries. And the primary is a difficult place to be. You have to be the master of none and the jack of all those trades. You have to know a little bit of something about. Your knowledge is supposed to be that wide, but only this deep. And hopefully you're familiar with a lot of those things, but eventually those primaries run out of options too. And when patients nowadays come in asking for other suggestions, we think about alternatives to care. And I remember thinking about alternatives as disciplines that were not necessarily proven, things that might not have any merit. If you work up in northern New Mexico, we're rubbing some crystals. We're going to use some curanderas. We're going to use these herbs and these particular treatments that, frankly, the clinicians on this side of the desk in Western medicine, we don't do too much about it.
Sure.
And I remember referring patients to the folks that are operating the vitamin hallway at Sprouts and at Wild Oats and General Nutrition Center. And those folks have better herbal knowledge than I do. Those folks know better how these vitamins may or may not interact and things like that. Excuse me. No, and so my thought was that maybe we bring some of the things that are not readily available to us in primary care into one space. And cannabis is another one of those options. So.
What are the types of alternative practices or procedures in addition to cannabis that you think are particularly effective or perhaps at least helpful in supplementing conventional medical care?
One of the things that I did learn from business school, if you intend to be everything to everyone, you'll eventually be nothing to no one. In starting in a practice, most of the thinking is to not necessarily spread it as wide as possible, but really to pick something and specialize in that.
Okay.
And it's a difficult thing for me to hang a shingle that that suggests that we're an alternative medicine practitioner and not have 1, 2, 3, 4, 5 different alternative medicine disciplines available for the patient. There's a lot of people to call. There's a lot of people that have great knowledge and great ability to interact with the patient and provide some relief to the patient. In this small practice to begin with, I think that I'm better doing a little bit less than offering a whole lot more. I like to specialize in and really get a good hold on what I can provide and do well with for the patient. So one of the things that I do very well is orthopedics. I taught orthopedics for the physician assistant students at UNM and medical students at UNM. And I've worked in ortho practices, ortho practices before. And I also think that one of the reasons why orthopedics is the area that I want to specialize in, or sports medicine, is because the cannabis-based therapies offer good evidence and good support with regards to reducing inflammation, increasing a person's activity level, and helping them to maintain an active lifestyle.
Sure.
So we bill our practice as an active lifestyle wellness practice. I think that in seeing my patients with United Healthcare also, I want to focus on an older population, a population that's 65 plus. I'm getting a little bit further along my own self, and as I see what's coming, it makes me feel more inspired to make sure that I am doing what I can to be well, to be around and to be physically active for my 4 and 7-year-old daughter, my 16-year-old son who's doing sports and being active right now. I need to kind of make sure that I'm on point and ready to go with some of those things. So naturally, I'm drawn to how am I going to preserve myself physically to stay on my soccer team and stay active for my kids and so forth. So long answer to the question is, in this particular practice, we're going to use the cannabis-based therapies. And I don't want to say that we specialize automatically in cannabis-based therapies, but those therapies are available for patients who have an indication for it. When we first signed the lease at this location, the guys that were offering the lease called me the CBD guys. Well, we're not the CBD guys. This is a medical clinic, first, second, and third. Mm-hmm. When patients have an indication for that use, we happen to know a whole lot about it. We happen to have those therapies available for patients. You can purchase those therapies here if you'd like to and take them with you. Or we can also direct you to other locations where you can buy your product, and you could do that appropriately after getting some good education and good knowledge, as well as for us to be able to manage patients who are using those therapies and correspond with their primaries, such that the primaries could theoretically refer patients to this practice because they don't know how to manage the patient on cannabis. Well, we know how to do that over here. And we've got other resources available to us that makes it better. It gives you better chances of being successful with your cannabis when you first start out. Another therapy that we utilize very regularly in this practice is professional supplements and nutrition. Mm-hmm. The nutrition and the exercise, along with an active lifestyle promoting clinic, maybe some interventions. If we need to do a needle in a joint, we can do that. We could do all of our imaging here. We have associations with X-ray associates, so I can get MRIs with or without contrast. We can do all of the lab work that we need to manage people appropriately. And we'll take this and do this like we should in a regular evidence-based clinic, but we're also going to refer you over to the nutritionist so that the nutritionist can take a full history and see where there may or may not be opportunities for improvement in your diet and your supplementation regimen. Because if we have that along with optimizing your Western medicine regimen, and we intervene when appropriate with some of the other therapies, I think that collectively is a fairly narrow focus and gives persons opportunity for some relief and increasing their likelihood to maintain an active lifestyle.
I could respond to. Thank you for watching this part of our interview. We truly hope that it helps as many people as possible, including some of you practitioners out there that are still open-minded and want to be able to utilize as many tools and resources as possible to continue to enhance the well-being of your patients. If you appreciate the content that we're bringing you nearly every single day, please consider hitting the like and subscribe buttons or sharing these videos with your friends and family. Consider becoming a Patreon to this channel or even a donor to the University of New Mexico Medical Cannabis Research Fund, where we are working very hard conducting cutting-edge research every single day, using all kinds of different types of research designs, working with humans, animals, large data sets. We do it all, and we're working really hard essentially to improve the well-being of our community. Through these efforts, collectively, together, we're starting to feel it. We're changing the world.